Welcome back to Holistic Healing Association. I'm Erin D'Arcy. I'm certified in embodied processing and clinical hypnosis. On September 10th, people gather in communities across Canada and across the world to show support for suicide prevention efforts and to remember and celebrate the lives of those that have died from suicide and comfort those who grieve the loss and loved ones to suicide. Personally, I know 3 people that have passed away from suicide. Today, I have with me Doctor Nick, who is a clinical psychologist and certified in somatic experiencing. We will discuss suicide, nervous system health, and self-harm. Self-harm is very common in children and is significantly more than people are aware of. There can be a stigma to suicide and self-harm that can prevent people from reaching out for help. Today, we would like to start to take down these walls and break down the stigma of suicide and self-harm. Dr. Nick will be talking about his own personal experiences. Thank you very much, Dr. Nick, for joining us.
This is a very personal story and something that I really felt was a good time to introduce out into the world, especially with everything that's going on with, youth suicide hotlines being shut down by this awful administration, and just the amount of people that feel so helpless and so hopeless, because that is one of the hallmarks of suicidal thoughts that drives a lot of this drives a lot of the suicidal ideations and behaviors, and a lot of the self-harm, right, can stem from these feelings of helplessness, hopelessness. And as someone watching so many people suffering through trauma right now, it felt like a good time to share my story and try to break some of the stigma.
And what brought you to the point of speaking so openly about being a suicide attempt survivor?
This is this is the first time that I've openly discussed it with someone who's not my wife. Uh, I am so fortunate now to have been with my wife now for almost 3 years. Our 1 year wedding anniversary will be coming up on New Year's Eve of this year, which I am so excited about and feel so happy about. The reason why it feels for me now that it's a good time to discuss it is I'm on the other side. I'm on the other side, and that feels so hopeful. And as a therapist, part of my job is to instill hope in people that don't have it yet. I tell clients, even if you cannot feel the hope, I will hold the hope for you until you're ready. They'll be right here with me. And I'm going to help you try to get to a space where you can have that hope too. And I think one of the hallmarks of somatic experiencing is to live with curiosity. And curiosity is parallel to hope. If you're hopeful, you can be curious about the future, about what's going to happen, about what your life could be. And for the first time in my life, after being with my wife and experiencing what love can be and what love should be, every day feels like a gift with her, and every day feels like a gift that I get to be here on this planet and help people and provide services and provide support. And for the first time, I'm scared of dying. And that hasn't been true for me since I was 12.
Wow.
And for me, that is the biggest sign that I am now on the other side of this. That this is something that will no longer control me, it will no longer influence me. And I want to share that story with as many people as I can, because suicidal thoughts, suicidal ideations are wrapped so tightly with helplessness and hopelessness. And it's felt so hopeless during when I was in it. But now being on the other side, I love life now. And that's a very, very odd sentence for me to say,
And
which is wonderful.
I believe there's many people that have been in your case that didn't feel like life would get better, and it did.
Yeah, it did. The fact that suicidal thoughts are so scary and they're so damaging and they're so corrosive and they're so insidious. And for the most part, they are extremely isolating because we feel like we can't share it, that we can't tell anyone, that we shouldn't tell anyone, especially men and especially men of color. And that is one of the main reasons why I wanted to come on today and talk about this, because I want men of color and men around the world to know it does not make you weak to have these thoughts. These thoughts oftentimes are automatic. Our nervous system responses are automatic. And these thoughts do not stem from weakness. They don't stem from not being able to handle a situation. They stem from what your body's experiencing. And sure, I'm not the strongest person out there. I'm not going to go into battle, with like a Viking helmet and a sword, but I think I'm pretty strong. I'm able to hold so much trauma for my clients. And for these people, having these thoughts is not an indicator of strength or weakness.
No, it's
And
not.
unfortunately, that's such a hallmark of what men are supposed to be in society. And I don't think that that's necessary anymore.
And I agree. And I believe that's also touched on the book, The Myth of Normal,
Yep.
written by Gabriel Mates. And as a woman, I will tell you too, I believe strength is feeling our emotions,
Yep.
processing our emotions,
Hmm.
right? Being vulnerable.
Yeah.
That's true strength.
Yeah.
And I agree too with, I always hear it, somatics, embodied processing is the missing piece of the puzzle, because it's body work. It's
Hmm.
processing our emotions, working with the nervous system. And until we're able to regulate our nervous system, we're not able to consciously understand it, to take it in. We need to be able to have a regulated nervous system.
Yeah. And to approach someone, whether it be family, whether it be, a friend, and to say, hey, I'm feeling this, and to be met with, well, why don't you just try this? Or why don't you just try being happy? Or why don't you just try thinking about it differently? That's not going to help. And that is what increased the severity so much more, was being met with that. And I think part of that is so steeped and so tied in with the stigma that our society has around suicidal thoughts and suicidal actions. We don't want to talk about it. We don't want to deal with it. A lot of people are so uncomfortable with the very idea, but that is what's causing so much of the unmet needs, is because we don't talk about it. It's because it's so taboo. It shouldn't be. Again, this was a nervous system response. I didn't choose it. I didn't want it. It was automatic. And we shouldn't punish people for having these thoughts. We shouldn't tell them that they're bad or that they're not trying hard enough. They are trying so much harder than you think they are. We do not know what internal battles someone is facing every single day. And
I agree.
I'm wishing and hoping that we start to meet with compassion versus, oh, you're not trying hard enough. To me, that's what triggered the most of this.
Because when we can meet people with compassion and love, they so desperately need that and support.
Yeah.
It's huge. That is a
Yeah.
huge part of for healing.